the heart of a sheep. Okay, and this is the anterior side, and this is the posterior side. Okay, how do I know? Anterior side, it is going to have, no, it's fat is all over. You can see these two vessels going this way, coronary vessels. Can you see that? So this kind of structure gives you an idea. It is the anterior side of the heart, and this one at the back means this is the posterior side of the heart. Okay, once you have figured that out, then know that heart is a little bit tilted and is placed like this, apex on the left side and like this. Okay, so this side is going to be the left side of the heart, this will be the right side. Okay, left side is going to be more muscular, right side is not going to be as muscular, because right side only pumps the blood all the way to the lung, which is close by. It's not like pumping it all the way to the tippy toe. Okay, now over here on the left side, do you see these auricles, kind of doggy ears? Okay, this and another one is here. Okay, so they kind of are hanging down like the doggy ears. They increase, yes, they increase the surface area of the atrium. Okay, auricles increase the surface area for the atrium. Okay, so this is going to be the left auricle, this is going to be the right auricle. Okay, these are the vessels you are seeing are the coronary vessels. Okay, and then right here would be the coronary sinus. Okay, right here would be the coronary sinus in this area. Okay, okay, so if we look at the different vessels, remember this is the right side and this is smushed heart, so it's not going to be as perfect as you will see it in the model. Now this vessel right here, this, if we open it up and look at it, do you see where it is going? When I cut the heart and I open it up, see where it is going? Right atrium. So what would this vessel be?
Superior.
What?
Vena cava.
Yes, and it is a sheep's heart. It does not have inferior vena cava.
Yeah.
Okay? Yes. Okay, so this is superior vena cava right here, this one. And you can feel the vessel, it's not as muscular. Okay? Then the next one is this, and if you trace it, it is coming here. So where is it coming? Into the,
Right into that ventricle.
into the, no, this is the left ventricle. You see? The thickness of the wall tells you this is the left side of the heart. And here it is so thin, you know this is the right side. Okay? So this is basically the aorta. And we are going to do some cosmetic surgery right here and make it, no, they did not cut it at the right place, so that is why it looks like two vessels, but it's not, it's aorta. Okay, so this is aorta and it opens into the right, what? I'm sorry, into the left ventricle. Okay, now looking at it again, this is what?
Or left one.
Left auricle. Now you see this vessel right here? This is going into the left auricle. So what is this vessel?
Left pulmonary.
Very good. So this is going to be the pulmonary vein. Pulmonary vein. Okay, so this is going to be the pulmonary vein. Now everything is kind of like weird because again it is a smooshed heart. So this is pulmonary vessel, which is the pulmonary vein. Okay, and it opens into the left what? Very good, left atrium. Now on the left side, do you see these? What valve is this? These flaps are making bicuspid left side. Okay, so this is going to be the bicuspid. What are these? Chordae tendineae. Very good. And these are attached to what? What do they attach to? Papillary muscle. And look over here. This is such a big papillary muscle. Do you see that? This big? Do you see that? Okay. Yes. And see how these chordae tendineae are attached to the papillary muscle right there. Do you see that? Do you see how it is attached here? Okay. This right here is the interventricular septum. Okay, it is dividing the right and the left ventricle. Okay, so this is that. Now, if you look right here, do you see all this crisscross of structures here? These are called trabeculicarnae. Okay, these are all trabeculicarnae. These crisscross structures. Okay. Okay, so now let's look at the right side. What is this on the right side?
The valve, right?
Which valve?
The tricuspid.
The tricuspid valve. Very good. Now, another thing is we talked about semilunar valves. Semilunar valves are like pockets. You see? This is one pocket. So there are three pockets like these present here. This is another one. You see this? You see this? And you see this? Huh? These are the semilunar valves of what?
Right.
Of aorta, because it is opening into the left ventricle. Okay, it's opening into the left ventricle. Okay, now this right here is the myocardium, isn't it?
Yes.
This that I showed you earlier, this is the epi. Epi. Okay, this is the epicardium outside. Okay, and then we have, what was the next one? Endocardium. You see this shiny surface? Do you see the shiny surface? This is the endocardium. Endocardium is shiny, which is also called endothelium, isn't it? Okay. Okay, now the next thing is, did I leave anything? Look at the checklist. Did I cover everything? And this is the fibrous pericardium. Which one? Interventricular septum. Yeah, this. Between the two ventricles, this is the interventricular septum. Did I cover everything?
The pulmonary artery is not going into the right atrium. Right? Pulmonary?
What?
Pulmonary artery is going into the right atrium.
Pulmonary artery is going to go in the right atrium. So this is the sheep's right atrium. So you see where it is coming out? So how will you find out which artery is what? You see where it is leading to. Do you understand? By looking at it, even I cannot make out what it is. Okay? So you figure it out by the probe. that where it is leading into. So whichever chamber it leads into, then you can figure it out from there.
Which
Then
one?
what it
Can we
is.
write on it and put R, and
Huh?
L and all that?
What?
I'm just curious.
Would the pulmonary artery come from the right ventricle?
Pulmonary artery is going to
It's
come from the right.
From the atrium
To the
the
lungs.
pulmonary.
No, it comes from the right
Ventricle.
ventricle and goes to the
To the
lungs.
lungs.
Okay, so that is how it is. And this is the uncut, of course. And here you will have to recognize the, this is the fibrous pericardium. It was pretty good. I didn't want to kind of
So the heart was,
like remove it.
Too good
was
to waste.
inside?
Yes, inside of it.
Wow.
It was inside of it. Like, shoo. Or maybe like this way, sorry. Oh, yeah. So this is like a trouser. For the heart. Okay, so that is how it is. Okay, and then we have the base, we have the apex, and this is the right auricle, this is the left auricle, and it's like this. Okay, this is the anterior. No, sorry, this is the anterior.
Pulmonary trunk on the outside.
Okay, because this single line is going to be at the posterior, so like this. Does it make sense?
The
So that
blue-
is what the heart is. Huh?
Pulmonary trunk.